Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be focusing on the family environment of a person with ambivalent attachment. Let's get started. Alright, the family environment of a person with ambivalent attachment is a really big story, and we can talk about it for a long time. But here's just a snippet of what that looks like. So what that in general looks like is that for the child who grows up in an ambivalent family, or in a family where their style results in an ambivalent attachment for the child, it's generally such that the caretakers are mostly focused emotionally on themselves. The child's experience turns very rapidly in such that they themselves as people are not really interesting. It's a family environment where the child's person, who they are as a human being, is not as interesting as how they can, it's how they can benefit the emotional well-being of the rest of the family that is interesting in that family system. Like, whenever it's about you as a person, we're not really interested in whether you want to be a pianist or whether you want to be a mathematician or whether you want to be a wrestler or whether we don't care much about that. What we do care about is that you keep it together when I feel overwhelmed. So for the child with an ambivalent attachment, they start noticing that whenever they are overwhelmed, their mother, their father, their caretakers, they are more overwhelmed. They don't get calm and relaxed and soothing and caring and stable within themselves such that they can act as pillars for their child. Instead, when the child becomes shaky, they notice an even shakier adult. Like when the child starts crying, their mother, for example, gets overwhelmed, starts yelling, starts losing it, they get sulky, maybe they even remove themselves and go to the room and come back out when the child's found a way to calm themselves down, which of course they often cannot. And so then they go into the room where their mom is gone and go, "Mommy, come out, I'm sorry, I didn't mean to do that, I didn't mean to be overwhelmed, I didn't mean to be naggy, I didn't mean to cry, I didn't mean to be troublesome in any way." So the child with an ambivalent attachment starts developing the sense that they cannot care for themselves, only other people can care for them, and in fact those people cannot care for them. So it becomes this system of, I can't regulate me, only you can regulate me, and it seems like the only way you can regulate me is if I take care of you. So if I make sure that I keep it clean, if I keep it calm, if I keep it nice, if I'm really competent and capable, then you will be calm enough to care for me, to regulate me, to, in return, make sure that I am okay. This then develops this push and pull between the ambivalent attachment person being extremely demanding on one hand and extremely compliant and caring on the other. I hope that this video was useful to you. If there was something that I said here that I didn't explain clearly enough, please drop a comment, let me know, and I'm happy to talk about this topic another 100 times, which is probably another how many times I would actually talk about it to give it some justice. So drop a like, please subscribe, let your friends know about the channel, and I'll see you again for the next one.